Just going. We'll be starting in less than a minute. Just going. We'll be starting in less than a minute. So, good evening, everyone. Welcome to Medical Mondays with Dr. O. I love our topic tonight because it's an area that we don't normally navigate. I'm a physician, a family practitioner, board certified family practitioner in Maryland. And I enjoy coming here every Monday at 7 p.m. to come learn and sometimes to impart knowledge. So tonight we have one of our amazing nurses who is in Maryland and help patients navigate to excellent health after they have gone through, is what I'll say, a difficult admission with sepsis in the hospital. So what is sepsis? It's infection that basically has affected everywhere. And that can lead to death easily if not well handled. And so in the hospital, it's important to do the needful to get the patient well to the point where they can be discharged. But after discharge is also very important. So we have Uzoamaka Igudu, who I'm going to yield the floor to now to educate us on how to navigate this terrain.
Thank you.
It
Oh,
does
sorry.
happen. Thank you. Welcome.
Thank you so much, Dr. O. Thank you, everyone, for having me. I will get right into it because I have about 20 something slides to go over and also to make time to ask questions if you do have any questions. Um, so I will get started with a little bit of introduction about myself. My name is Uzoma Kaigudu. You can call me Uzo as well. I do go by that. And I am a registered nurse serving as a sepsis transitional nurse navigator, also known as a TNN. You will hear me use TNN a lot throughout the presentation. So I currently serve at an area hospital. In this role, I developed a transitional nurse navigator workflow. This workflow is now incorporated into the hospital's sepsis post discharge program. Our program consists of two TNNs and a sepsis nurse practitioner. And what we do is we support patients who have experienced sepsis as they transition from hospital to home. Um, so, what is sepsis? Just like Dr. O mentioned, but I will expand on that a little bit. It's a life-threatening condition. It's associated with significant morbidity and mortality. In the United States alone, at least 350,000 adults who do develop sepsis, they die during hospitalization or are discharged to hospice. Hospice is pretty much a place where patients who decide that they don't want to continue with treatment and they prefer to get comfort care. For patients who do survive sepsis and they do go home, that period following hospital discharge is very important, it's crucial. And the patients do have a high risk of declining their health status, along with coming back into the hospital, being readmitted, or coming back to the emergency room. So my role as the sepsis TNN, it was created to address these challenges by ensuring that after discharge, the continuity of care goes smoothly, and that patients don't decline or have any warning signs of sepsis while they're home. Um, and the way we do that mostly is through patient and caregiver education. Education is huge with sepsis, and it's ongoing, and it starts from the time they're in the hospital all the way through their discharge at home, when they're discharged home, and also ongoing after that. We also do care coordination. The key is identification of any kind of complications from sepsis, early identification, and then we also do a structured virtual follow up. And the virtual follow up we do is either by telephone calls or with a telemedicine video visit with our nurse practitioner. The goal of this role is to support recovery, reduce preventable readmissions to the hospital, and then also improve outcomes for patients, which is the most important goal for patients who are recovering from sepsis. According to the CDC, so sepsis is not the infection. We always want to clarify that. Sepsis is the body's extreme reaction to an infection. It is a life-threatening medical emergency. What happens is that um, sepsis does happen when you have the infection already, and then it triggers a chain reaction throughout your body, meaning that your organs, kidney, start to shut down. It could also be your lungs, it could be your heart. And it also depends on the source where it starts. But regardless of the source, it can affect multiple organs in your body. And without fast treatment, it can quickly lead to tissue damage, organ failure, and unfortunately, death. Um, Infections that commonly lead to sepsis, and a lot of times we look at these as common infections because they tend to happen every day. It could be, um, infection that starts in your GI tract. It could be something as easy as something you ate. It could be as a GI, um, you know, bacteria that you got, and if people around you are sick and somehow you're not clean or you don't wash your hands and you end up getting an infection. It may not affect the other person whom you got the infection from or the bacteria from. However, each person has a different response, and we'll talk about um, what actually triggers the response to sepsis, each person's body's response to sepsis. Also, the lung. So you have like your pneumonias, those are the big ones. Skin infections, urinary tract infections. The biggest one that we see in our hospital is lung infections and urinary tract infections. So your pneumonias and your urinary tract infections are the most common causes of sepsis. Signs and symptoms. Um, we like to say that if that if you do develop one of these symptoms, that you shouldn't get worried. Well, sepsis is serious. So, like I said, obviously, if you have a weakened immune system or if you have other health conditions or comorbidities, you really do have to be concerned, I would say. So, a person with sepsis might have one or more of the following signs and symptoms: sweaty skin or feeling clammy, cold, confusion or disorientation, extreme pain or discomfort, depending on where the source of the infection is. Fever, shivering, feeling cold, your heart rate might be high or beating fast, or your pulse might be weak, shortness of breath, or feeling like difficulty breathing. And a lot of times, these are symptoms that you will have when you do have an infection. You get an infection like a pneumonia. You may get shortness of breath. Not everyone with pneumonia gets shortness of breath, but if you do have comorbidities or weakened immune system, you may have shortness of breath, and that would be a cause for concern or to seek immediate attention prior to it getting worse. Um, Fever also. You can see with pneumonia or urinary tract infection. Um, Pain or discomfort, you may have chest pain with pneumonia. Or if you have any kind of GI symptom, or if you've had surgery um, and there's an infection going on after surgery, you may develop extreme pain. That could be a sign, along with fever. Altered mental status is a big one, which means you can be confused. And we'll go more into education and warning signs of these because confusion comes and disorientation comes in different. Obviously, if you do have a history of pre-existing condition of someone who has dementia or something like that, you have to go based on what their baseline is. And I always tell patients, how was how was your family member, your loved one behaving the day before or the week before, and what is the change? So, um, so those are some signs and symptoms. But if you do have, someone with sepsis may have one, or they may have several, or all of the following listed. Some quick facts about sepsis. According to the CDC, each year, at least 1.7 million adults in the US develop sepsis. At least, I had mentioned earlier that 350,000 adults who do develop sepsis die during their hospitalization. One in three people who dies in a hospital, they had sepsis uh, during their stay in the hospital. So hospital acquired infections are prevalent as well. That can happen. Most cases of sepsis do, however, start before a patient goes to the hospital. So there are some early warning signs that people may look at as, oh, I'll just watch it for a few days. And then most people who develop sepsis have at least one pre-existing medical condition like chronic lung disease or weakened immune system. So with our assessment, we in the hospital when we start off with the process of post discharge or following patients who had sepsis in the hospital and they're going home, we do screen and identify the patients. Um, and the hospital has developed a system which I think has been very helpful in alerting when the patient walks into the emergency room if the patient does have obvious signs of sepsis or the possibility of developing sepsis. So there is a sepsis alert system um, that our hospital created and also generates a list. So we identify the patients, we review their medical records to understand if it is sepsis, number one, the severity of sepsis, and what treatment they're getting in the hospital. Then we also look at their comorbidities, their pre-existing conditions, what they have. Then we do meet with the patient and their family at the bedside to, first of all, assess their understanding of sepsis, symptoms, and the importance of ongoing care after they get discharged. At that time, we do give them a brochure or some paperwork, just generic paperwork. Like I said, education at the bedside is somewhat limited. We do that, but a lot of patients who are in the hospital who are sick or recovering from sepsis at that point, they're not really in a state to receive a lot of information. So a lot of our education happens after they go home. We provide education about sepsis, signs and symptoms, um, the importance of taking their medications, especially their antibiotics, and making sure they have follow up appointments or any dietary or lifestyle changes that are needed. We discussed that as well. Then we collaborate with the hospital team to develop a care plan, an individualized care plan, obviously, for the patient. And it all depends on the patient's needs. So we collaborate with the in-hospital provider, the case manager, also the nurses as well, physical therapists, and other healthcare team that are part of the patient's care in the hospital. We ensure that the care plan includes clear instructions for the patients when they go home. Um, especially for medications, meaning patients need to know why they're taking these new medications, side effects, and are they able to afford the medications. Then wound care, if the patient does have a wound, that could also be a source of infection. So if there's wound care that needs, patients should get instructions, or if a home health nurse needs to be part of the discharge plan, make sure that that is established prior to discharge. Then we also, at the bedside, try to schedule follow up appointments. We find in our program, and I'll discuss more about how we started this program as a pilot. We found that close follow up with a provider within 7 days really made a difference in terms of patients' recovery from sepsis, and reducing the risk of them coming back into the hospital. So we, as the TNNs, we would reach out to the patients within 48 hours after they discharge over the phone, and we'll go a little more into that in a few slides. And then make sure that in 7 days they have an appointment with our provider, and that's where our sepsis nurse practitioner comes in. Because these days it is difficult and challenging to obviously for patients to see their PCP or primary care doctors within 7 days, or any other specialist. We also ensure that any necessary lab tests are noted for the patient also in their discharge plan or discharge summary. Medication management, this is key. This is very important because a lot of times you have patients who are prescribed antibiotics and they go home and for some reason, either they're not able to get it from the pharmacy, or they're taking the wrong dose, or they have side effects from the medication and the antibiotics and they stop taking it. So we want to confirm that the patient does understand the medications, the doses, the dosing, the frequency, and any kind of side effects they may have. We ensure that the patient has sufficient supply of the medications upon discharge. Um, and also, there are other medications too. For example, patients who are diabetics, we do try to ensure that if they need insulin refilled, we try to get that also as well. If they get that delivered to their bedside, which is the next step. So our hospital does have a system where they deliver patients' medications to their bedside, especially patients with sepsis, to make sure that they have it in hand, especially your antibiotics, make sure that they have it in hand before they go home. Some patients do decline this service, but it is offered. Um, and then home health services. This is crucial also. I do feel like this is where some facilities, I wouldn't say, but I would say this for my facility, do lack in terms of seeing the importance and the need of having a home health nurse, a skilled nurse, coming to the home, especially a patient who experienced sepsis or had sepsis in the hospital, discharged home. Um, but what we do is assess if the patient requires home health services, such as wound care. If the patient is being discharged home on IV medications like IV antibiotics or physical therapy, or even just education, medication management, we try to ensure that. We all try to ensure that home health services have been arranged and also educate the patient and their family about the role of home health professionals. And I'll go more into vital signs because, the patients will say, oh, what is a home health nurse coming to do? Just take vital signs. Well, the vital signs are crucial in monitoring post discharge to see, obviously, if a patient has a fever, if their oxygen level is, if they're having any shortness of breath or difficulty breathing, and they're maintaining their oxygen level. So the vital signs are very important. And the home health, at least the home health nurses that we work with, they've become our eyes when they go see patient, and we're able to communicate with them, and they're able to give us information and data on how the patient's doing, and that helps our role as well. Monitoring and follow-up. So at the bedside, we do schedule follow-up appointments with the primary care physician or specialist. If, like I said, if we're not able to get in with a 7-day appointment, which most of the times we're not, we do schedule with our sepsis nurse practitioner a telemedicine appointment. We also have the option of transitional care center, which is part of the hospital, where it's a resource for patients who are not able to get in with their primary care provider within a reasonable amount of time, both after discharge or with a specialist. And they do have providers there that do see patients after they leave the hospital. We also teach patients at the bedside how to monitor their vitals. We give them thermometers. The hospital does have disposable thermometers, and we're able to provide them with that. Fortunately, we're not able to provide patients with blood pressure monitors or pulse oximeters to check their oxygen level. So we encourage them to try to purchase that, and we give them resources of where to go to get them at a not so expensive price. And then we also educate them on when to seek immediate medical attention if their condition worsens. We provide our contact information if they have any concerns regarding their conditions. You can always contact us. Symptom management. We do educate the patients and family on recognizing sepsis-related symptoms. We do educate them on monitoring their temperature, fever. I think I had mentioned this earlier, increased heart rate, their breathing, their appetite, um, worsening if they have a wound, worsening wound condition, if they're getting IV antibiotics at home, how to make sure that they're keeping the site clean and monitored every day. And then obviously if the patient has any changes in their mental status, we also educate them on that. And then in addition to that, we do instruct them on when to contact their healthcare team or seek emergency care based on how severe their symptoms are at home. This is called a sepsis stoplight tool that we use. It's from Sutter Health. This is a great tool. We've really been using this since we started the program. And what it does is we hand this to patient and go over, things to look at. So these are called zone warnings. There's the green zone where we obviously want patients to stay after discharge. We want them to be in the green zone. The yellow zone are the early warning signs that I believe a lot of patients do miss. A lot of times patients go from the green zone directly into the red zone. So the green zone means I got discharged from the hospital. I'm feeling better, not at my baseline better, but I'm doing a little better. My breathing is better. It's normal for me. Okay, I haven't had a fever in 24 hours and I don't feel cold. My energy level's fine. My thinking is clear. I feel like I'm improving based on what they had. If they had pneumonia or urinary tract infection, they feel like it's improving. The symptoms are improving. Or if they had a wound, it's healing. Um, we do then on the yellow zone is where we have to let them know that if you start to develop symptoms that differ from the green zone, where you're feeling pretty much quote unquote normal of it at their baseline. Um, we tell them if they start to notice any changes in their heartbeat or breathing a little faster than normal, if they have a fever, and the fever is the part we have to specify. We don't, even though it says 100 to 101.4, it really does depend. If it's a patient who has is currently on chemotherapy, or if they have cancer and they're on chemotherapy, any fever at all, um, they need to let their provider know, or they need to let us know. But we give them some parameters as far as what numbers to monitor in terms of their temperature. if they feel cold or they just feel like they can't get warm, if they're shivering, if they notice that they were doing well the day before, but they're too tired to do most of the activities they normally do, also known as, activities of daily living. If they're too tired to do those, if they're feeling a little slow, they don't feel too well, they're not worse yet, but they're just not the way they were previously or a few days ago. Also, if they have gone a few days or a few hours and they haven't urinated, um, those are the yellow, that's the yellow zone. And we always encourage patients to, you need to let us know, let your provider know you need to be evaluated at this point. Otherwise, what happens is that if not addressed, if not treated, patients will easily go into the red zone. And in the red zone, they need to come back to the hospital where their heart's beating very fast, their breathing's fast, if they have a cough or pneumonia, they may be coughing up blood, chest pain. If they have a high fever, 101.5, or if they're, hypothermic, their temperature is below 96.8. If they notice paleness or blue or changes in color in their skin, if they're tired, or they're lethargic, weak, they cannot do any activities, or someone tells them that they're just not making sense, or they feel sick. This is where we see a lot of our patients when they come in. They're in the red zone. Um, so we go over this sepsis. We use the sepsis tool like stoplight tool as well. We do discuss also patients who are appetite. Appetite is one that I don't think it's included in here. But if they have a normal appetite, that would be good in the green zone. That's where we want them. If they're not feeling as hungry or a little nauseous, then obviously they need to talk to somebody about it. At least call their provider, call us and let us know. And then if they're vomiting, they're not able to keep anything down. They're obviously dehydrated. They need to come back into the hospital. We do connect our patients and their family with community resources for sepsis treatment and prevention. As needed, we do currently engage with the county's Department of Aging and Disability. They do have nurses who, for patients who are 60 and over, would go to see patients in the home to address what we call social determinants of health. So patients who are not able to afford medications, patients who are uninsured and need assistance, um, patients who either financially they're just not stable or they don't or they're homeless. We do have nurses, case managers from the county's Department of Aging that will go and try to see how they can assist patients. And we ensure that the patient has their medical equipment or supplies at home, for example, oxygen, or if they have any have a need for any breathing devices, um, we make sure that they have that as well prior to going home. Our documentation, we do have we with everything we do maintain detailed records of patient interactions, care plans, and outcomes. Um, like I said, we communicate with patients. We call them 48 hours after they go home. Then TNNs do. And then if they don't already have an appointment set up with a nurse practitioner, we offer them that appointment within 7 days. Some patients will decline, but we'll try to assist them if they need an appointment with their primary care or if they need an appointment with a specialist. We do try to facilitate that as well. Um, see here. So here is an example of our initial post-discharge call. It's very detailed, it's long. However, this is the call we make within 48 hours after. This is the documentation we use for the calls we make within 48 hours after discharge. We do make subsequent calls within the course of 30 days because our program is transitional. So our goal is to ensure that they don't get readmitted in 30 days and that they're recovering from sepsis. So what we do is we make the initial call with, with the patient or their family member. We get a lot of, obviously subjective data based on what it is and what the cause of their sepsis it was and what the infection was. So we do ask them these questions regarding breathing, symptoms, fever, obviously urinary symptoms. If they have a tube or catheter, those are high, those are puts patients at risk for developing urinary tract infections. So we do um, address that or ask about that and get that as a subjective data for assessment. Then we get vital signs from patients where we get their temperature, blood pressure, obviously pulse. We try to get those if the patients do have that available at home. If not, we do encourage that they do get at least the blood pressure or the pulse oximeter, once again, depending on what infection, what source of infection that they had that caused sepsis. We review their medications over the phone. We do review it at the bedside, but post discharge, we review it a little bit more in depth. We make sure that patients receive their medications prior to leaving the hospital. Another important thing is, can the patients afford the medication? This is an example of what we call social determinants of health. Patients who have financial challenges are not able to afford antibiotics for whatever reason, not being uninsured. For example, they don't have insurance, so they're not able to afford that. If they have any concerns about the medications, do they understand why they're taking the medication and the doses? We see a lot of discrepancy here in terms of patient not taking correct doses of antibiotics. Patients who thought they were supposed to be taking it once a day and are been taking it um, they're supposed to take it twice a day, but they've been taking it once a day. So when we call the patients within that 48-hour period, we're able to catch that and we're able to educate them and review their medications again with them, make sure that they are taking the correct dose. We also discuss side effects with patients. And then we ensure that follow-up appointments have been scheduled, either with our team or with their primary care, their specialists, or our transitional care center. We also find out if the patient has home health, if the home health agency has contacted the patient. If not, we do facilitate that. We do contact the agency to find out when their first visit or subsequent visit will be. Um, Devices that the patient has at home, if the patient has oxygen, if the patient has a nebulizer, for example, or any kind of blood glucose monitoring device, we do identify that here. Um, in the documentation, we also do review when in the call, we review self-care management education. Like I said previously, with sepsis and recovery from sepsis, education is ongoing after discharge and post, even after 30 days, education is still ongoing. So we review the zone warning signs that I showed in the previous slide. We go over that with patients, make sure they understand that, review their vital signs, discuss their diagnosis if they have any questions. Um, and also, this is where we also um, give them, let them know these are the symptoms you look for. If you develop any of this, or any of these symptoms listed, fever, chills, coughing, a blood worsening cough, urinary symptoms, burning or pain with urination, stomach pain, um, blood in the urine, weakness, confusion, we let them know they need to seek evaluation for that. And then we go over prevention. We ensure that the patient, you know, knows about hand hygiene, and I'll go over more ways to prevent sepsis and prevent infection towards the end of the slides. We ensure that the patient is aware of their follow-up visits. We do have patients who, for some reason, either they're not able to go for their appointments, they do not show up for the appointments for any different reasons. But what we try to do is we try to reschedule the patients, make sure we address any barriers that are preventing them from either following up with the provider. And then we also review what tests need to be done, lab tests or x-rays, CAT scans that need to be done after they leave the hospital. We review their medication list, like I mentioned earlier, make sure that the patient understands why they're on the medication and any changes, because a lot of times patients go in the hospital, changes are made to their regular routine medications, uh, and patients may not be aware of that. So we review all this in their discharge plan and discharge summary. Um, we ensure the patient understands the importance of adhering to their medications, keeping their scheduled appointments, checking their vital signs, and moving around. If you've been in the hospital a long time, especially the patients who are elderly, they do tend to get what we call deconditioning, meaning their muscles get weak. So we try to encourage ambulation after any kind of prolonged hospitalization. Use of incentive spirometer, which is important. We do try to hand this to patients at the bedside. It's basically what we call a lung exercise to help to expand the lungs, the lung capacity, so that they can get in more air. And it can happen just laying in the hospital bed, especially patients who've had pneumonia or any kind of respiratory infection. We go over proper hygiene and encourage patients to hydrate, make sure that they're hydrated at home. Um, we also go over vaccinations on the whole measures, make sure patients are up to date with their vaccines, flu vaccine, pneumonia vaccines, RSV vaccines. Make sure that they're up to date. If not, we recommend that they do get their vaccines, including COVID as well. We also try to assess if a patient smokes cigarettes because that does increase their risk of developing sepsis, especially pneumonia um, infections that cause sepsis. So we do try to address them with smoking, offer them smoking cessation classes if needed, or medications like your nicotine patches. We do try to facilitate that as well. Um, and then patients for the elderly or patients who have any kind of issues with swallowing, we do encourage, make sure that they discuss aspiration precautions, because what happens is after patients eat or drink, certain patients who are at risk for this, for aspiration, we make sure that after they eat or drink anything that they're not laying down right away, that they're sitting up for a good hour, 45 minutes to an hour prior to laying down, because there is pneumonia called aspiration pneumonia, and that can also be a source or cause of sepsis. Then we discuss also their devices that they have at home. The last is that we talk about their barriers. These are barriers, what I mentioned earlier, social determinants of health. These are barriers that will prevent a patient from recovering fully or from not taking their appropriate measures after discharge um, to recovery or recovering from sepsis. And these social determinants of health will easily bring the patient back to the hospital. So, transportation, if they don't have a way to get to see their specialist, the patients who are homebound, for example, who are not able, if they've had surgery in the hospital and they had sepsis, they had surgery and they have to follow up with their surgeon. How do they go to that appointment? If they had stitches or staples, how did they get to that appointment? So sometimes patients will come back to the emergency room and call an ambulance to take them back to the emergency room because they just have no way to get um, to their surgeons for follow up. We also address food, smoking, health literacy is huge, and that's where a lot of our education comes in about sepsis. We push in our program, we push for a lot of education and making sure that patients are educated and empowered. Because after 30 days, if they've progressed and their symptoms have improved, and we've transitioned them to the necessary team, their primary care or their specialists, we want to make sure that they have the knowledge base to find out if they develop symptoms, know what to do, ask appropriate questions to their providers ask themselves, I have the symptom. Is this a cause for concern? Do I need to go see my doctor? Do I need blood work? Do I need chest x-rays? To basically have patients to advocate for themselves as well. Then also medication affordability. We have patients obviously who do not have health insurance and not able to afford medications. Even with insurance, co-pays of some certain medications are extremely expensive, so patients do have financial challenges. We try to address this by linking them up with community resources. Um, One of them is, like I mentioned earlier, through our Department of Aging um, and Disability. Post-discharge follow-up, we do follow patients, like I said, after that initial 48-hour post-discharge call. We'll make, depending on how severe or how the patient is recovering at home, we'll make about maybe 1, 2 calls a week. I'm sorry, 1 call per week. Sometimes it is multiple calls based on the patient needs. And we'll call them maybe every other week, depends. And you have patients who, by the 30 days, they said they feel better. They've taken the antibiotics, they've followed up, their symptoms are improved. So at that point, we will sign off, but they do have our information to let us know if they have any other questions or concerns. And patient and family empowerment, I mentioned that earlier, that, goal of our program is really to encourage patients through education and their family to take a, it says active role, but I believe it should be proactive role in their recovery. So meaning catching, knowing what their baseline norm is in terms of their symptoms after they get discharged, and knowing what the early warning signs are, or asking questions about vaccines even prior to it being recommended by their primary care. So a lot of that is part of what our education consists of. We provide resources also and information so that they can, as patients, feel empowered to make informed decisions about their health, because that's the ultimate goal. Sepsis prevention strategies. The key, obviously, is to prevent infection. Um, Infections will happen, um, but the basic ones, we say wash your hands using soap and water, hand hygiene, um, hand sanitizers. Um, if you have a weakened immune system, or you have um, you know comorbidities or pre-existing conditions that will put you at risk for sepsis, you want to stay away from people who have coughs, or wear a mask. Getting recommended vaccines, that's important. Vaccines will not prevent you from getting sick. However, it can prevent the severity, how sick you get. So we always encourage that. This is the flu season. COVID also is prevalent. Flu is very prevalent. Um, we have respiratory infection, RSV vaccines, which is common in the elderly. So we encourage patients to get their vaccines. Also, take good care of their chronic conditions. Patients who are diabetics are at risk for sepsis, lung disease, cancer, any kind of kidney disease. These can increase the risk of developing sepsis. If they have a wound, they need to keep that clean as well. Or if they have an IV, those are sources of infection. So if they're getting IV antibiotics at home, they need to make sure that that site is clean and taken care of, so that they don't get infections to the site. Also, let's see. We talked about good hygiene, keeping cuts and wounds clean, keeping their hands clean, and knowing basically sepsis signs and symptoms. So knowledge is key always, especially when it comes to sepsis prevention. I put this slide in here just to kind of give a little bit of data. In regards to our program, when we started the sepsis post-discharge program, it really started as a pilot. Um, and the goal of a program was to see if our program, our sepsis post-discharge program, could reduce 30 daily admission rates for patients who had sepsis. When we first started this program, the pilot study, we started in October 2023, and then we ran the program till April 2024, the study for about 6 months. And what we wanted to do was look at pneumonia at that point because pneumonia for this particular hospital where I work was the leading cause of sepsis um, for patients who come in with sepsis. So what we did was we developed with my workflow that I incorporated into the program. We developed a structured post-discharge follow-up, um, and basically what it included was um, me. I'm screening the patients and reviewing their charts along with the provider, and then making phone calls 48 hours post discharge to assess for symptoms, and then make doing a setting up a telehealth visit within 7 days of discharge with our provider, and then doing follow-ups for a course of 30 days in regards to patients' progress and improvement at home. Um, the study was successful. It basically showed a 58% reduction rate in sepsis readmission rate for the hospital. So obviously, we just looked at a small bucket, which is pneumonia. Right now, from April 2024, we've progressed to looking at all sepsis, not just pneumonia, but looking at all causes of sepsis. Um, the program, like I said, was successful, reduced readmissions. However, it still had implications um, in regards to that. It was a single center pilot. It was just done at our hospital, not looking at sepsis as a whole. However, it's led to not just a reduction of readmission rate, but we're able to get a full-time nurse practitioner in our team currently, and also another TNN that I to work with me. So um, so this was a success to the beginning of our program. So once again, I'll kind of sum it all up with sepsis. It really is about time um, and temperature, higher or lower than normal, just a way to kind of sum it all up. Infection, you may have signs and symptoms of an infection, mental decline, confusion, sleepy, difficult to arouse, or any kind of behavior changes that you may notice or someone close to you may notice. And then E, extremely ill, severe pain, discomfort, shortness of breath. Um, so when it comes to sepsis, it's really about time, and these are things just to watch out for. And always ask, could this be sepsis? You're safer asking and it not being sepsis than just ignoring your symptoms. So thank you.
Wow. Thank you.
I know it was a lot of information, but
No,
I try to cut it down.
this was a lot of much needed information. And thank you so much for you personally for what you have contributed into medicine generally. The slide you showed, I think it was the last slide that you
Mm,
showed, I was reading those who came together to do the research to see how your intervention had worked. And I was really impressed. Thank you.
thank
Because what you
you.
have done, it's changed medicine and, changed lives. People think that when they've been discharged from their hospitals, because I've heard this a lot. They say, oh, it's because they kicked them out, it's because of insurance. No, there's something called nosocomial infection.
Mm,
That is infection that people can get. That's not why you into the hospital. You were sick, you're admitted, but then your life can be complicated more if you get this infection from the hospital, that
yeah,
it's not because hospital is not clean or they're not utilizing the proper precautions. These things happen. That's why we want to shorten the time of admission as much as possible and continue care at home when the patient is stable, because your home is actually better than being in the hospital. So I'm going to stop there for a minute, and I'll ask you to please put down the slides so that, I'll be able to see people's hands
Sure.
more. If you have questions, kindly raise your hand to ask the question
Sorry, I'm trying
or
to.
put the question in the chat box. So if you please put this slide down, thank you. That's fantastic. So speaker mode, fantastic. I have questions and I have comments. Auntie
You
Tower,
know,
Auntie Tower from Tampa, Florida said, thanks for the wonderful presentation. And Mika said, very informative presentation. Auntie Tower can relate to you because she's retired. She's one of our aunties on Medical Mondays with Dr. Ho, but she's a nurse. A nurse is always a nurse. And she worked in various areas that were similar to yours. So I know she appreciated this talk. You talked about a lot of
yeah,
things. I mean, management, things to look for, um, and all that. And I can go on and on. I don't want to repeat what you have said, but a slide you showed, another slide that really impacted me is the
mhm,
sepsis prevention strategies.
okay,
Because we talk about sepsis
yeah,
that kills people if not properly handled,
okay,
or if not handled on time. And you nicely have showed us how to identify that there is trouble, how to know that it's time to get help. You showed it time, right?
yes,
Temperature, infection, and all of that.
yes,
Prevention is key.
it's key,
In
yeah,
everything, we do much better in all disease entities preventing than, allowing it to happen and then intervening. So, prevention, you talked about washing hands. And I wanted us to chat a little bit about that, you know, because we still believe in medicine that the best way to keep your hands clean is that soap and water. Um, COVID brought hand sanitizers that we now use a lot of, but the soap and water is still not replaceable. So when you have the chance to wash your hands with soap and water, please do so. If you don't, an hand sanitizer is what you have, use it. But medical practitioners, regardless of what kind of practitioner, starting from, anywhere, doctors, NPs, nurses, um, physician assistants, medical assistants, the list goes on. When we first get home from anywhere, what's the first thing we do? Get soap and water and wash your hands. Because, and that includes pharmacies. Dr. Khadijat, am I right? Am I right?
Absolutely correct. Can you hear me?
Yes, now we can hear
Okay.
you. Thank
Yes.
you. Pharmacists, everybody. When we get home, the first thing we do is wash your hands with that soap and water. You cannot know, you cannot remember where your hands had been. Even if you just got from work into your car, your hands have been God knows where. So it's important to wash hands. There's
and,
misuse
and
of
can I
gloves.
expound on that also, Dr. O?
Sorry,
And can I expand on that a little bit
please,
on
please.
hand washing? And we say that because it's really the most basic and as simple as it seems, it really can, especially if you are at risk of or have any pre-existing conditions. Hand washing is probably the most basic. Vaccines, yeah, also yes. But hand washing, hand hygiene can it's the least expensive, least obviously, least costly, basic ways to prevent infection. Um, because we talk about sepsis, we almost don't even want to talk about sepsis, but we're talking about sepsis because that's what happens when the infection does hit your body. Sepsis basically can be it's a downhill from there. So if you don't stop the infection at the prevention part or the start of it or what you can do to prevent it, once you do get that infection, you just never know how your body is going to react to something like, pneumonia or a GI bug or something that you got from someone. If you do have pre existing conditions, that even puts you at a higher risk of developing sepsis. Unfortunately, we don't want to talk about sepsis, but it is prevalent. It is prevalent. So we do have to discuss that. So I always say the costly, basic, easiest thing that you can do is really wash your hands with soap and water.
Thank you so much. We cannot emphasize that enough. We found out during COVID that our hands go to our faces more than we think. You know, I saw it on TV. I think it was on CNN or something, where it was shown that our hands go to our faces more than we think, and that's another point. That's another reason to keep your hands clean. Then I wanted to talk about the misuse of gloves. 2020 brought about the use of gloves, but there has been misuse of gloves, especially, just think about this. Think about a restaurant where somebody wear gloves and they dished out food, in those, places where you pick what you want and somebody's dishing it out. And then they finish dishing it out, and with those same gloved hands, they go to the cashier's machine and they machine what you ordered, and you give them money, say you give them cash, or I don't know, or you didn't do well with your credit card, they help you with your credit card. God knows where your hands had been, and that exchange. And because they used gloved hands, their hands is actually not touching whatever is in their environment. They don't realize what they're transmitting from one point to the other. Let me make it more practical. This last Christmas, I was in Nigeria and we fed over 500 people. And the caterer who did the cooking last year. And I just happened to come outside and I saw right, early in the morning, just after the rams were killed, um, I came out just to see what was going on, and I saw one batch of plantains. And I said, "Is this the plantains you're going to cook for the whole neighborhood, everybody coming?" She said, "Yes." I said, "Excuse me, this is not more than what we cook to eat in the house. We paid for this. Why is that?" My sister was on the phone and she said, "Please, put it on video." I put it on video and she said, it's the same caterer from last year. She said they all had diarrhea after they ate. And I'm like, well, we got the same caterer. So what went wrong? First of all, fix my plantains. I love fried plantains. And I felt everybody should have enough plantains. So guess what? Just in case you're doing things like that in Nigeria, please keep an eye on it. They went to get more plantains, lots more plantains. They were kept somewhere. They were not brought there, but they brought them. And of course, we had enough. But I started walking through the process of this caterer because I told her that this last year, nobody's going to have diarrhea, not on my shift. Let's see what you're doing wrong. And I found it out. They had gloves on. In fact, when I called her to talk to me, she had the same gloves on. And she was walking away with the gloves. She will use the gloves to wash the fish, to wash the meat, to hold the spoon, to stir the soup. And it's the same gloves. They don't change the gloves to do now serve food. Just think of how many places those gloves have been in. So I explained that to her in simple language. And I said, it's better, just take the gloves off. Use your hands. You will know when you touch water or you touch oil and you need to wash your hands. But with the gloves on, you don't feel it. So you just keep going. And she was like, oh, okay. She took the gloves off. I said, when it's time to start serving, you can put on gloves if you want to. We all ate for Christmas. She cooked again for New Year, another over 500 people we served, and nobody had any problems just from gloves.
Mm.
Please, let's be careful and attentive. Shaking hands also. People who know me very well know that I don't shake hands. I shook somebody's hands today and I was like, oh my gosh, I don't know why I shook your hand. I don't shake hands. I will chop knuckle, or is that what you call it? When you do this and give a bump.
Or top knuckle.
It's called chop knuckle. Thank you. I would do that. And, or I hug. I'm a hugger. I'd rather do that. And when I hug, I'm breathing. Anything when I do that, because you don't know what the person you are hugging have. So you don't breathe in any respiratory issue. And then coughing properly is another thing that I see. When you cough and you cough into your hands, which most people do like that, um, you can take those hands to open a doorknob, for instance. Then you put the virus right there on the knob. Anyone else that opens that door is exposed to whatever you have. And when you cough and you don't cover your mouth, whatever you're coughing out goes straight up and then it spreads like that. It goes straight and spreads. So it's three dimensions, straight and spread. So you don't cough without, covering your mouth. The best way to cough, the protective way to cough is by coughing into your elbow. So you go like that. Or when you're sneezing, sneeze into your elbow. Those are the healthy ways to do it. I'm sorry. I had to, make those points because I'm big on prevention.
Yes,
Simple things we can do to
I agree.
prevent infection that can then lead to sepsis. And it's not only older people that get septic.
No, it's not. And I mentioned the elderly just because they are at risk. However, a lot of patients who do end up with, you know, debilitated we've seen patients in their 20s, late 20s, 30s. It's across
Any
all age
age.
groups. Yeah, it's across all age groups.
Yes, any age. So please let us prevent. There's a question in the chat box that have you found if there are over-the-counter medicines that can help minimize the effect or symptoms of sepsis?
No, not sepsis. However,
No.
in fact, once again, we go back to prevention, right? We go back to your basics of hand washing, making sure you have your vaccines, wearing masks if needed, um, and then if you've done that, and if you do have over-the-counter medications, I can't make any recommendations. But they do have some over-the-counter for
Actually, we
colds,
don't.
but
The answer, because we don't establish care on this
yeah,
platform. We don't establish patient or physician-patient interaction on this platform. So we will not discuss medication that treat what, but there are no over-the-counter medication
mhm,
suggestions for sepsis.
sepsis,
If
no,
somebody has those symptoms, the slides were put up, and it was thoroughly encouraged that you go to
and
the
get help.
hospital.
Yeah, you need to.
Actually, not to your primary care doctor, just go to the emergency room at that point.
With the counter treatment for sepsis. No.
No. See, we have various medical personnel interjecting here. There are no over-the-counter medications for sepsis. If you have those symptoms that were highlighted, please go to the emergency room. That's the best thing.
Sorry if I can also add. How do you know in your home you have sepsis? for you to go looking for over the counter. It's a hospital situation. You don't diagnose sepsis in your room, you know. And again, I know there was a slide talking about when to do what, like temperature and that. I believe there was also another slide that was talking about taking note of your body and things like that. Sepsis may be one of the other symptoms goes to when mentally you're not present. So in that case, we're hoping that family members or caregivers are well trained or educated to be able to identify what to do. It's like, for example, a naloxone case. Somebody's already right there on the floor. They're not going to be able to administer that to themselves. Hopefully, a neighbor, a family, or a caregiver is able to know what to do. Situation, right?
True, true.
Correct.
And again,
Correct.
I want to reiterate what you said. You can diagnose yourself. Thank God in America we don't do that. In places like Africa, we still have work. We still need to be able to recognize that there are certain people that are clinicians that diagnose and recommend treatment. And then we go to pharmacists that would dispense and not go to nurses and pharmacists to diagnose. We need to learn that. But in America, clinicians will diagnose you. When you have fever, you can breathe, fatigue, confusion, all of those things that we discussed, go to the emergency room.
Like once again, I'll reiterate, even before you get to that stage, there are early warning signs for the most part. We've talked to a lot of patients that we follow, and there was something, there was a fall. There was a fall, for example. They've never fallen before. Why are they falling? But they never questioned further than that. And the next thing, the patient was in the hospital. So early signs of infection is just the key also to knowing. You unfortunately you don't want to get to the part where you're being diagnosed as having sepsis, but you want to early onset monitor your symptoms, especially if you've had sepsis in the hospital and you're now home. You want to monitor, your temperature, all your mental status, your behavior, or have a family member with you. Also, especially if you were in a hospital for for a period of time with sepsis.
Thank you so much. And I pray that none of us have to deal with sepsis. That we take the precautions needed to avoid infection to start off with. Thank you so much. This has been very educational. Before I ask you to give us your closing remarks, Dr. Ezugu, do you have any comments? That's a cardiologist. Do you have any comments?
Thank you so much. Sepsis, thank you for your presentation on sepsis. Sepsis is one of those conditions for those people that deal with critical care. That is something you don't really wish on any human being. You really want to take whatever step you can do to prevent it from even happening. And when you sense that a person is getting an infection, because what it means is that the infection is now in your bloodstream and is attacking your organs. And it will attack your organs from any place where blood goes to, from your brain to your eyes, to your heart, to your kidney. It can lead to the failure of all your organs, then to the, to your fingers being broken and being cut off because of infection in those. It is one of those conditions you don't even wish on your enemy. So the only solution to preventing it is preventive, modalities, cleaning. If you go to, let's say, for a room where a person had, let's say, a bone infection, and they're in that room, do you know that somebody who is cleaning that room, cleaning the bed, cleaning so that there is no atom of infection that will touch that skin that's born, because otherwise that infection will kill that individual more than the fire itself. So sepsis for us Jesus. It's like when you say that the army has invaded your home and you have to do whatever you can. And that's the body reacts that way and can actually destroy itself during in septic state. So we don't play with it. And sorry, my comment on it is just that it's so scary that the people that treat it, which are critical care specialists, don't want anybody to get sepsis. We don't. Thank you for your presentation.
Thank you.
Yeah,
Thank you so much. And
yeah.
again, I second Dr. Izugu to thank you, or even beyond the presentation again, for your contribution to medicine, for the post-op care. As like you said, a lot of people when they come out of when they get discharged after having sepsis in the hospital, they get discharged into hospice. That means palliative care to death. You're going to die. So let's make your life comfortable at that point. So, like Dr. Izugu said, it's not child's play. And I pray that everybody on this platform get it so that we do the preventive things. We prevent instead of allowing it to even happen. Infections are not fun. They're not a good thing. So before I call you to give your closing remarks, I wanted to call on Tracy Bonilla from CAF. CAF is an organization that has been so impactful in our communities. When we do health fairs, Global Vision Foundation, my nonprofit organization, we do health fairs all over the nation, especially in Maryland and DC, and we do medical missions presently to Nigeria, Ghana, and Kenya are places that we have been, and we just did one in Nigeria. Most of you got the pictures and updates already from that one. CAF is an organization that we call on in Maryland to help us give food, free food away to people when we do health fairs. They give fresh produce. And I'm telling you, they don't give two tomatoes, one onion. No, they give bags to each person of different fresh vegetables and different things, meats sometimes, chicken and all that they will give away. They don't only do that. During the housing crash, they stepped up in education, in intervention to save a lot of people's houses. So tonight, they just put on the platform that, if you need housing advice, please unmute Frezi. I said, look, I'm not talking to her. I want her to share with us really quickly. Kindly unmute and share with us really quickly what you doing in terms of housing. Thank you.
Good evening, everybody. Thank you so much, Dr. O.
Frezi, can we see your face?
Let me see if I can turn on the camera here.
Please turn on your camera. Let's see you. It makes it better. Thank you.
How are you?
Welcome.
How are you, everybody? Good evening. Thank you so much for the information, Nurse Egudu. Really interesting. Just like the other doctor mentioned to me, the word sepsis is like death. But like understanding what it entails and how to prevent it. And I was kind of laughing to myself when you, Dr. O, and you were speaking about washing hands. The importance, because I tell my husband all the time, before he prepares food, I'm like, wash your hands. And he's like, I just washed them. No, I'm like, you washed them after you use the bathroom, then you touch the remote control, then you touch this, then you touch that. And he's like, oh, this woman. But I have to keep pushing him, and my kids too. I say, you have to wash your hands right before you touch food, right before you eat, because it's going into your body, and you just never know what could be in your hands. And he says, if you were a nurse, you'll probably inject me with something just to keep me sterilized. But anyways, just wanted to say this meeting was very, very helpful, very informative. It's complicated, right, to understand the whole thing, but I think the best thing to understand is how preventable it is and how it could be treated. I did have a question just in case. I mentioned there if there's any like over-the-counter medicine that can assist or minimize the effects or symptoms of sepsis at all that you found through your, experience.
No, I think, like we had mentioned, unfortunately, when you're at that stage of sepsis, you need to be in the hospital. We don't want anyone to get to that stage. So prevention then is the key. If you do have an infection, you recognize it early so that you can see a provider, get medications like prescription medications, but not for sepsis. So infection and sepsis are two different things. So the infection is what leads to sepsis. Sepsis is not the infection. Sepsis is actually what happens to your body as a result of the infection. So, but no, there are no over-the-counter medications to help minimize effects of symptoms of sepsis.
I see. Thank you so much. So yes, thank you so much for this meeting and also for the opportunity to share what Center of Assistance to Family does. I'm not sure if I'm able to share just a quick, just a list of our programs. It's a little bit helpful to see it. I'm not sure if I can share my screen. But either way, there's a lot of different programs that we do. The main programs that we do for the community include housing, counseling, and education. So we assist clients that are looking to buy a home for the first time through providing a HUD approved education course. So it's a class that you take to get informed about, the beginning to the end of the home purchase journey, including all the professionals involved, who is involved, how to get ready for home purchase, what you need to do to get ready, and throughout the whole process, who's going to be involved and everything else. We also help those folks that are already homeowners and they're in the risk of losing their home due to foreclosure prevention. Due to foreclosure. So we do foreclosure prevention counseling, which is basically assisting the client communicate with the bank to come up with a solution to avoid the loss, of the home. And so there's different cases, there's different situations. And so we work with the client to be able to avoid the loss or at least minimize the impact of the loss of the home, right? And we also help clients who are renting. We don't have financial assistance, but we do know of a lot of other community resources, depending on the county, the state that the client calls us from. We're able to connect them with different programs and many times help them apply for those programs, right? Provide guidance as to how to do that. And we also we work a lot with, like Dr. O mentioned, we worked a lot with other nonprofit organizations to provide financial literacy, know about, the importance of budgeting, financial management, credit, and banking. And also we work with churches. We have many organizations we work with. All of our services are free. We're a nonprofit. And of course, another program or another service we provide through the help of our partners is food distributions. So we hold food distributions along with financial literacy workshops every weekend. So we have partner churches, congregations, and other nonprofits in which we partner with, and through a donor we provide fresh fruits and veggies, as Dr. O was saying. And so we're able to get the help from the host to be able to provide an event, a food distribution event with their community. So we are able to not only provide, fresh fruits and veggies, but we're also able to provide information as to what we do as an organization and other programs that may benefit them to know about. So it helps with outreach. Dr. O mentioned COVID. During COVID, we were able to reach out to the community about, what type of things to do to avoid COVID contamination, what services were available in the community. All these things we're able to create outreach for the community through food distributions. And so, of course, food distributions attract a lot of audiences, right? And so we're able to disperse that information that is necessary for the community. So many things that we do. We also have other programs like workforce development, also healthy homes and healthy environment, which are programs dealing with environmental health and what we could do as a community to impact our environment positively. And so there's many programs, but the basis is financial education and housing counseling services. So CAF stands for Center of Assistance to Families. The name is in Spanish, Centro de Apoyo Familiar, but we assist anyone in English or Spanish or whatever language they speak. We assist them. They're all welcome to come, and we're able to provide the assistance. So thank you so much. I'm not sure if anybody has any questions. I'm going to provide a link to our website and also our office phone number here in Maryland. So if anybody would like to reach us, they could reach out to us. And the best way to reach me, if you like to reach me, would be my email. So I'll also be providing that. Thank you so much, Dr. O, and everybody.
Thank you. Thank you for all you do and for all the lives you touched and have saved. We appreciate you. Thank you. Please
Thank
put
you.
that link there, and they're nationwide, so you can access, assistance from them from anywhere. Thank you. Yeah, that's the website.
Yes,
Thank you. And my
thank
love
you.
to my sister Walkyria.
Definitely, I will. Thank you. It's both our birthdays today. It's her
Oh,
birthday, it's my birthday, and
happy birthday.
and so
A
we're
great
here. We're
day.
glad
Oh,
to.
wow.
But yes, she definitely appreciates Dr. O and everything. All our partnerships,
Oh,
CAF and Dr. O, we've been partners for a long time. CAF really appreciates your partnership as well, Dr. O,
yeah, for
and everybody here.
decades.
So
Yeah.
thank you so
Thank you.
much.
And thank you for coming on Medical Mondays with Dr. O on your birthday. We appreciate that. Thank you.
Appreciate.
Thank you. So, my darling dear, oh my gosh, sister.
Are we allowed to sing for her? Happy
Yes, please.
birthday to you.
Go
Listen,
ahead.
it's quite a dedication for her to show up here.
Go ahead, please. Let's
So,
sing.
Francie, happy birthday
Birthday
to
to
you.
you.
Happy
Happy
birthday
birthday.
to you.
Birthday.
Come on, you guys come with your emojis. Show
Happy
her
Happy
love.
birthday.
birthday.
Happy
Happy
birthday to
birthday to you.
Yeah.
Happy
Happy
birthday.
birthday.
We love you. Thank you.
Thank you so much. Thank
Happy
you. Thank
birthday.
you.
Birthday.
Take
Happy
care, everybody. Thank you
birthday.
so much.
Happy
Appreciate it.
birthday.
And may
Thank
the good
you.
Lord bless you.
Amen.
Amen. Amen.
Amen.
Thank you.
Amen,
Receive
Dr.
it.
Zugu.
Amen. Thank you.
Breezy, kindly check your chat box. I
Oh,
sent you a message.
okay. So I'm going to yield back to you to give us your closing remarks.
So basically, I'm gonna reiterate prevention, prevention, prevention. When it comes to sepsis, hand washing, soap water, vaccines, eating healthy foods, drinking water, and report any signs, any early signs. I discussed those zone warnings. If you could take anything out of this, in addition to prevention, just take those zone warnings: the green, the yellow. If you're in that yellow zone, try to seek talk to your provider right away. Signs of sepsis. Sepsis is very dangerous. And we just try to prevent it and just everyone stay healthy.
Yes. Thank you. I'm going to borrow that phrase going forward. Everyone stay healthy. Thank you so much.
Thank
We
you.
appreciate you.
Thank
This
you.
has been fabulous.
Thank you for
Thank you.
having me.
Great education, very important and